Greetings. I'm Dr. Jenice Rankins. I'm a nutritionist and an associate professor at the Florida State University in Tallahassee, Florida. Every semester, I'm responsible for teaching community nutrition. And for the last 7 semesters, my community nutrition students have developed stellar projects in the area of nutrition informatics. So today, I'm here to introduce the Nutrition Informatics Project for school term fall 2011. The theme is achieving nutrient adequacy within energy balance. And this is a theme that has been central to all of the nutrition informatics projects conducted by the community nutrition students here at the Florida State University. I want to talk with all the students out there who are going to be doing a nutrition informatics project. Now, our nutrition informatics project at Florida State University focuses on life cycle groups. There are 4 life cycle groups that are included in this project, and they are children, adolescents, adults, and the young old. Now, the young old would be our target population from 51 to 70. Children, we're looking at a segment of the children's population, and that age group would be from 4 to 8 years old. A segment of the adolescent population that's included in this project would be from 14 to 18 years, and the last life cycle group, young adults, include 19 to 30-year-olds. Now, within our term project, we have a theme, and our theme each semester is achieving nutrient adequacy within energy needs. And this is also the #1 dietary guideline for Americans. So how do we go about doing this project? There are 4 components to the project. If we want to intervene to solve a problem, we must know what the problem is. So in order to determine the problem in a community, we do a community needs assessment. This is also referred to as a community diagnosis. Once we have done the community diagnosis, we are able to find the key target group need and the resources that are available to meet those needs. So first is the community needs assessment. Secondly, we would like to focus on trying to determine the nutrient which is of the highest priority need in each target group. We start with a group of nutrients that have been identified as nutrients of public health concern by public health and nutrition officials. Some of these nutrients would include those nutrients that you see on the food label, such as the mineral calcium, the mineral iron, vitamins A and C, fiber, as well as sodium in order to keep sodium at a lower level because of sodium's connection with hypertension, particularly in sodium-sensitive populations. And we also focus on trying to regulate our intake of saturated fat, trans fat, and total fat because of the connection between cardiovascular disease primarily. So those are the main nutrients that we all will be looking at, but within different populations, some of these nutrients are of higher priority than other nutrients. That is what we will be, that's the component of the project that will use the National Health and Nutrition Examination database. So we have a needs assessment, we have an assessment of nutritional status using the National Health and Nutrition Examination database. And that assessment of nutritional status will include dietary intake assessment, biological values or blood values assessment, and it will also include an anthropometric assessment, because the focus on achieving energy balance or maintaining energy balance is really directed toward obesity prevention. And therefore, we will need measures in our target population that could help us to assess obesity within each target group population. Now, number 3, once the problem is identified, we want to do something about it. So in community nutrition, we focus on behavioral change. And our main mechanism for behavioral change in the community is education, awareness. So there will be a nutrition education plan developed as a part of this nutrition informatics project. And we will use that nutrition education plan to develop a nutrition education website so that we will be able to get out our intervention to the maximum number of our target group representatives in the community. This is a project that we do every semester in community nutrition at the Florida State University. Now, this seems like a tremendous amount of work for one semester of students. However, the work is shared through collaboration. We use Blackboard systems and particularly group page, and especially, and discussion boards. Each student within a life cycle group has a primary responsibility for just one of those 4 components of our needs assessment. However, all students will learn the process of carrying out each of these components of the term project. And we will use collaboration via the Blackboard to make sure that census building occurs within each group as it needs to occur within communities if we are to achieve our desired outcomes and incomes, okay? So, I just want to leave you with a few tips for being successful in this needs assessment project. I call them the B's P's. Number one BP is to be present, because if you are absent, you can do nothing. Number 2, be punctual, because if you are late, you will make mistakes. Number 3, P, is to be proactive. There's no need to wait around for someone to tell you what to do if you have the 4th P, which is to be prepared. Now, if you are present, punctual, prepared, proactive, there's still another need, P need. Be positive, because positivity is contagious. And positivity can lead to creativity, cohesion, and optimal outcomes. So, I look forward this semester to some excellent websites that would incorporate, number 1, needs assessment in your community. Number 2, identifying the nutrients of greatest need and assessing obesity in your population. And number 3, developing a nutrition education plan to meet that need. Number 4, incorporating all of those outcomes into a fabulous nutrition education website that your target population in the community will love, and that it will have an impact on their behavior, their nutritional status, and their ability to achieve nutrient adequacy within energy balance. Thank you.